Welcome back to Breaking It Down with Jodi Marks. We are in season 2. Yes, I said season 2, and I am so excited to bring you once again an amazing topic for today. So our topic is the importance of Black blood donors, and we have two amazing women with us today. We have Tiffany and Nicole. Hi, ladies. Welcome.
Hello.
Thank you for joining me. So the first question I just wanted to ask you was, can you both give a little background about yourselves and how you came on to being on this panel? So Tiffany, can you start first?
Sure. Well, my name is Tiffany Taylor. I'm an external communications manager with the American Red Cross. And my Red Cross journey started when I was 16 years old, when I first donated blood at my high school at an SGA drive. And so my father had always been a blood donor, and the American Red Cross would call our home and ask him to schedule an appointment. And, you know, back in the day when there were landline phones and you're answering the phone for your parents. I just asked my dad one day, I was like, why does the Red Cross call so much? And he said, because I have O-type blood, you have O-type blood, and it's a blood type that's always in high demand. And so when you become eligible to donate, they'll be calling you too. And he was right. And so from 16 years old, up until adulthood age, I became a second generation Black blood donor. And I'm so excited about being a part of the American Red Cross. My journey picked up again in college with Hurricane Katrina, where I volunteered to help support disaster services in regards to that. And then a few years later, I saw the opportunity to join as an employee with the American Red Cross in communications for blood services. And so I've been with the Red Cross for 5.5 years, and it's just been an amazing journey ever since.
Oh, so when you say like services, like what do you do on a daily basis? So is it just like getting word out or going to those places, disaster places?
So for a while, I've really covered blood services. So it's been a matter of getting the word out about the need for blood in our local and national communities, and also helping to promote those open to the public blood drives so that people know that those opportunities are aware for them to go and roll up a sleeve.
Yes. And then Nicole?
Hello. So my name is Nicole Creech, and I was actually diagnosed with sickle cell anemia at about 6 months of age. I had my first crisis, and through the years, I've actually done really well. I had my first blood transfusion in the 2nd grade, and from there, I got jaundiced. Back then in the 70s, the process was a little different than it is now. And so now we don't have as many risks involved with donating and receiving the blood. More recently, though, however, probably in the last 3 years, I have become blood transfusion dependent and typically need a blood transfusion now. It had gone from about 3 to 4 months to now 3 to 4 weeks. In fact, I just had a blood transfusion this past Thursday. So yeah, it's been really, life-saving for me to get blood, to have blood on a regular basis. For those that don't know, sickle cell anemia actually is a deformity in the hemoglobin. Our red blood cells can sickle. Our bodies may not produce red blood cells on a regular basis like you do. My body doesn't produce red blood cells like it should. And typically red blood cells turn over every 120 days. Unfortunately, my body doesn't know how to replenish it on its own. So I have to have blood donations so that I can continue to live my best life.
Okay. How do you feel during this time with COVID going in? Is it safe? Or do you feel safe?
So I feel safe at my clinic. They do the pre-call where they ask you all the questions, if you've had any muscle aches, loss of taste or smell, pre-COVID questions. And inside, they're only asking that patients come and no caregivers. The scheduling, I believe, has been such that there aren't too many patients at once in any waiting room at the clinic or anything like that. So I've seen a lot of the medical community really, really stepping up as far as cleanliness and sanitizing areas and that kind of thing. I feel safe going. I've been a member, a patient at my clinic for 25 years. And I've gotten exceptional care there. So they all seem to be taking really good care of us.
That's very good. That's very good to hear. I'm happy that we're doing that for you guys. So why is it important to have Black blood donors? Either one.
Gladly. It's super important to have Black blood donors because building a diverse blood supply is critical just to meeting the medical needs of an increased diverse population. But also, too, it's super important because each blood type, which is inherited, it's determined by antigens, and there are over 600 known antigens. Some of them are very unique to one's racial or ethnic makeup. And so when we're talking about sickle cell patients, many times because they receive so many transfusions throughout their lifetime, they run the risk of rejecting the blood transfusion after a while if that transfusion is not coming from someone with the same blood type and same ethnicity. So well-matched blood can actually decrease the risk of complications related to transfusion therapy, especially in patients who receive lifelong transfusion. So it's critical for us to ensure that we have a good number of Black blood donors so that those who are impacted by sickle cell, which we know more than 100,000 African Americans are impacted by sickle cell in the US, we want to make sure that we have blood readily available to be able to treat those needs.
Yeah, I didn't know that before doing like the research for this, that you actually would, like give, the same ethnicity that blood. I thought that they were like, oh, she needs A, B, or oh, she needs O. And then there's like, okay, here's a bag. I didn't like, that's just the ignorance that we all just think if we don't have to go through it, we just think, oh, that's how it is. And that's why I think a lot of people don't know the importance of actually donating and know that they are actually giving back and know that it is actually very important and you are giving somebody basically a way of life if they have no other means. And talking to people, like trying to research and asking questions of like, do you know that this is important? A lot of people are like, no, like I don't, or like, oh, I don't want to donate because it's COVID time. Like, oh, I used to donate, but I'm not donating anymore because it's COVID. Has that happened a lot?
Yes, we've definitely seen a decline in our overall number of donors due to COVID, but we understand for various reasons. But most importantly, we've seen a huge decline in our number of Black blood donors. And just to put it in perspective, in just 2019, we had I think about 15,000 Black blood donors who gave in 2019. And then in 2020, after Corona hit, we had about 2,700. So just think about that number from 15,000 to 2,700. And so we definitely understand amid this pandemic that part of that significant decrease with Black donors is most likely due to the fact that the Black community has been disproportionately impacted by COVID-19 infection rates, hospitalizations, as well as deaths. And so we truly understand that. We also understand that many of our communities, were closed and shut down, and that also impacted the number of blood drives that many of those in the Black community attended at colleges and high schools. So when schools were unable to host drives, that creates a decreased opportunity to roll up a sleeve. When businesses are unable to host drives, that impacts that as well. But we do also understand that there were those who had concerns about safety. Is it safe to donate blood? If my community is telling me that I need to socially distance or I need to limit where I go, is it okay to donate blood? And so as part of my role as a communicator, I spent a large amount of time from March to May, educating the community with the help of the media, letting them know that number one, donating blood is an essential service. It's something that's needed. It's something that our medical teams definitely need because while they're dealing with coronavirus, they didn't want to have to deal they didn't need to have to deal with a blood shortage on top of coronavirus. And then also we wanted to make sure that the community was aware that there are, patients who have immune deficiencies, or they're dealing with chronic illnesses that may require blood transfusion and treatment like sickle cell, cancer, so on and so forth. And so getting that messaging out to let them know it's perfectly safe to donate blood, as well as the safety measures that we were putting in place to help to further ensure that we would ensure a safe process for them was part of my task. And we've been able to effectively do that with the American Red Cross across the country. And I'm happy to say we haven't had a lot of questions about safety concerns as of lately, but we do understand that there are those who may have not donated since before COVID, or they haven't donated blood at all, and they're not aware of what safety measures we have in place, or they're not aware that donating blood is an essential service that our governors, our president, our health officials are encouraging the community to actually help out with, to donate blood because it's needed.
And what safety measures are you taking? What are you doing so everyone knows that it is safe to go and give blood?
So to ensure the health and safety of not only our staff and our donors, we have implemented new safety protocols, including temperature checks for both staff and donors prior to entering a blood drive or donation center. We're also requiring face masks or coverings that they're required for everyone. And if you don't have one, we make sure that we provide one to you. We provide hand sanitizer, and we make sure that it's available throughout the entire donation process. We're also wiping down all donor touched areas and sanitizing them throughout the entire process, before, during, after. And we're also putting in place social distancing provisions in our waiting areas as well as our donation areas. And we're also encouraging donors to schedule an appointment prior to arrival to help ensure that we can manage our donor flow at our donation centers and our blood drives.
That's a lot, and that is very good, because I know a lot of people are very cautious of, a lot of people will be there donating because, one person goes in, so how is it going to be clean, but that's very good. I feel safer doing that. But how would you go about donating? Like, where do you go to find a place to even donate? Like you said, a lot of places have kind of shut down, like businesses and stuff like that.
The amazing thing about the American Red Cross is that we provide 40% of the nation's blood supply. And so by visiting redcrossblood.org or downloading the Red Cross Blood Donor app, or by scheduling an appointment by calling us at 1-800-RED-CROSS, you can find your nearest blood donation appointment. On the app and on the website, it's as simple as typing in your zip code. So even if you're traveling, you can type in your zip code and find your nearest blood donation opportunity.
How many times can you give blood? How many times can you donate?
You can donate whole blood every 56 days. And you can donate Power Red every 112 days. And what Power Red is, it's just a concentrated donation of red blood cells, where you're actually kind of doing double the duty. It's a donation that's very popular with people who have jobs like maybe they are truck drivers and they're on the road a lot and they're not able to, come in as often, but it allows them to kind of give a concentrated amount of red blood cells, donate double the duty in that one setting, and then be able to come back 112 days later and donate again.
Okay. Nicole, what kind of blood transfusions do you get?
So I usually get a unit of packed red cells and marked special, probably because I have built up so many antibodies. And I would love to get one of those Power Red packs. I'm sure that'd be great. But I have also often wondered, I do get the universal O negative. I'm B positive, so I can accept O. But I've often wondered about the quality of the blood and if it mattered if, say, I was getting the blood from a young runner who is vegan versus a bus driver who eats donuts for lunch. Sometimes I feel really, really great. I call it my superwoman juice. And other times it doesn't feel like I really got a donation at all, or doesn't seem to last very long. Do we have any scientific information about that, Tiffany?
We do not have any scientific donation related to that. However, we understand that people who receive transfusions may give an account or a test in terms of how they felt when they had the transfusion and how it made them feel. But all the blood that is donated is tested in our labs. I would think that perhaps maybe you feel different based on if the donation is the same type as yours. We do understand that O-neg is the universal donor, the transfusion. It can be transfused to any blood type. And it's often what first responders reach for first in a situation of emergency when there's not enough time to be able to type the patient's blood type. And so, that could be, a component of it, not sure. But I have heard different people who've received blood transfusions say, oh, I felt this way, or I felt that way, or I felt like, it may have come from a person who was like this. And I've also heard that from people who've received organ transplants as well, that they felt differently once those organs were, they received that transplant. So no scientific backing to support what people have stated that they feel when they have those different exchanges. But rest assured, usually from a scientific standpoint, we're just testing it, making sure that it's safe, making sure that it will be most compatible based on the need. And that's really our biggest focus and what we can attest to.
Thank you.
Do you try to give, Black donors to Black patients? Because I'm also thinking, would she feel sluggish if, say, it didn't come from a Black donor?
Well, that's the reason why we are encouraging well-matched donations, and that's why we focus on right type matching. So through our Sickle Cell Warrior program, that's something that we encourage Black donors to do. We used to encourage them to designate their blood donation to go to support a sickle cell patient. Well, now we have it set up where we don't have to necessarily ask them to designate, because not everyone knows that they want to designate their blood. And so what we do now is once it goes into our inventory, we're able to, with the information of the donor and then the information that the hospital is wanting to supply to support the patient, we're able to create a match and help in that way. And so that's why it's so important for the Black community everywhere to donate blood, because also too, with the American Red Cross, we have a national blood donation system, which means we can also help best match by transferring that blood from wherever it's needed to where it's needed. So if you're in California and we have someone who's in Texas who is the same ethnicity, same blood type, and we know that that's going to be a better transfusion, we can transport that blood to California to support that patient there. And so that is really the remarkable aspect about donating with the Red Cross, is because we are able to help meet those needs. And that's why it's so important for Black donors everywhere to donate. And it's also good to know those areas where we have a higher need for Black donors to give. And you can imagine it's probably in those more metropolitan areas where we have an increased number of Black population, like Philadelphia, Baltimore, Atlanta, Columbia, South Carolina, Oakland, California, Detroit, Michigan, Richmond, Virginia, St. Louis, Missouri, and even Birmingham, Alabama. So those are the geographies where we're seeing the highest need of Black blood donors right now during this pandemic. But that doesn't mean we don't need Black donors anywhere else. We need all Black donors who are eligible, who are healthy and well and willing to roll up a sleeve and give. And if you're ineligible to donate blood, we encourage you to consider hosting a blood drive. Those are ways that you can definitely help ensure that other Black donors are able to give and support patients who are requiring those right type match products.
What would make you ineligible to give blood? A lot of things.
There are a number of things that can make you ineligible. And so I would definitely encourage, if someone is questioning eligibility, that they can actually visit us at redcrossblood.org, and we have an eligibility tab. And you can type in anything from medications, from looking to see where you've traveled recently. Those are things that can make you ineligible. Age can make you ineligible. You have to be at least 16 years old with parental consent in most states, 17 years old without parental consent. There is no age cap in the United States, so that's a good thing. But what we're also seeing is that we need more younger donors. So we need more high schoolers, more college students, more young adults, that young adult bracket. Between, those mid-20s up into those late 30s, early 40s, that demographic tends to fall off. And it could be because maybe they're focusing on career and family and things of that nature. But those are all needed. Also, if you get a tattoo and at a facility that's not state regulated, that can make you ineligible. But I encourage anyone who may be concerned about any medications they take, any diagnosis they have, any traveling that they've done, to check the website, redcrossblood.org, or call 1-800-RED-CROSS, and you're able to see if you can donate. We have a number of people who have diagnoses and they assume that because they have it, that they're ineligible to donate, and that may not necessarily be true. Individuals with hypertension, high blood pressure, if that is well managed with your medication, you could be eligible to donate. Individuals with diabetes, again, if you're managing it well with your medication, you may be eligible to donate blood. So these are all reasons why it's super important to check out your eligibility. Give us a call if that's easiest for you. Or like I said, visit us at redcrossblood.org and check the eligibility tab.
Yes, don't just assume you can't. Actually do your research and, go about the right steps. Because a lot of people, like you said, especially diabetes, honestly, I would think you couldn't either with all the insulin you have to take. And that's good to know. You have resources to go to, and we'll link these resources as well for anybody that would like to check, and we'll have them linked after the show. So you can go and check out if you're eligible or not. Also, how would you go about volunteering, even if you weren't eligible, if you just wanted to be a volunteer?
If you want to be a volunteer, you can visit us at redcross.org or 1-800-RED CROSS and just sign up to volunteer. You would type in your zip code and there's a page where they will find your nearest Red Cross and get you connected with a volunteer coordinator. There are multiple ways you can volunteer, whether that's virtually. You can also volunteer at blood drives as a blood drive ambassador. That's someone who welcomes people into the blood drive area, allows you to sign in, takes your temperature, and assists you, whether it's to the donor bed or walking you to the refreshment area. We also have transportation specialists who help us transport the blood from the American Red Cross lab to the hospitals. So there's so many ways that you can support the Red Cross as a volunteer. And of course, you can always support us through our disaster services work by signing up there as well to support anytime there's a disaster.
That's awesome. I want to take a step back because you said you have a sickle cell program.
Yes.
So how does that work?
So basically now it's just an initiative to help get the word out, to engage and tell the stories of sickle cell warriors, and also get those who are eligible to help support sickle cell patients more involved, and so that they can see how their blood donations are impactful. Sickle cell impacts the African-American demographic, but it also impacts the Hispanic demographic. So we're looking for increased donations from both of those to ensure that we can do more right type matching, so that when Nicole needs a blood donation, she can have her blood type, same ethnicity, and it's a better experience, especially since she receives them more often. And what that does, those transfusions do, is it helps the oxygen levels in those red blood cells. It helps it to flow so that those cells don't sickle and create pain crises for her. And I know Nicole can discuss a little more in depth what those pain crises are like, because there's some people who, sickle cell is kind of new to them and they're not aware of what a sickle cell warrior goes through during that time. But I know Nicole can speak more to that for us.
Yes, please, Nicole.
So during a sickle cell pain crisis, our cells, our red blood cells that are usually round and plump, really take on a sickle cell shape, and they tend to get stuck in our veins and our joints and our bones and our long bones and our arms, our legs, our back. They actually stop the flow of oxygen to many of our organs and can also cause really severe damage in that way too. These crises are severely painful. It's like having broken glass flowing through your veins. It could be like having your leg in a brace that somebody's just crushing the brace, lifting the brace off, crushing the brace, lifting the brace off. It's like you can feel your heartbeat in your bone. So the pain can be sharp, it can be dull, it can feel like you're being stabbed a million times all over your body.
That sounds like, oh, I can't even imagine. I honestly couldn't even imagine. Did it get worse as you got older?
So I was a really, really sick child. I was in the hospital a lot for sickle cell. As I got older, when I turned 36 years old, I was diagnosed with pulmonary hypertension secondary to sickle cell, probably due to acute chest syndrome, which is another thing that sickle cell causes in the lungs and the chest area. So with my pulmonary hypertension diagnosis, I have been on medication for that for the last 12 years. So to say that it gets worse, you are more susceptible excuse me, you are more susceptible to secondary chronic illnesses. Your pain crises could become a little quite more intense or more often. I have chronic pain now every day. And so that seems to be something that as a youngster, you may not have pain every day, but as you get older, the pain just seems to always be there. And so it's super important that people with sickle cell stay hydrated and go to their clinics and receive the care that they need, get their labs drawn, even during the time of COVID. It is just super important. I know that a lot of people are afraid right now to go to emergency rooms to get care because of COVID. But sickle cell can be life-threatening, and it's super, super important that we go and we get the care that we deserve.
And when you get your blood transfusions, does that give you relief? A little bit relief?
It does. It does. I always tease my friends and tell them that I was about a quart low of oil. Blood actually feels like it's lubricating to my bones and my joints and that sort of thing. My chest loosens up, is not as tight. And yeah, I mean, because the loss of blood or the fact that my body doesn't make the blood anymore, I get low. And so I probably am a little dry inside.
How much blood do you receive in one transfusion?
So typically, my number is 7. If my hemoglobin is below 7, I will get 2 units of blood. If it's 7.2, 7.3, I will get 1 unit just to kind of help me maintain. A normal person, a normal woman's, hemoglobin level is 14. So sickle cell patients tend to run low. Last week, my hemoglobin level was 5.3. And one of the nurses actually asked me, "How are you walking around
Oh, gosh.
with so little blood in your body?" And I said, "It hurts. It's painful, but I manage." And unfortunately, that's a story that we all share as well. We become very used to walking around with low blood levels. Our bodies just kind of acclimate to it. But it does tend to cause a lot of pain when that happens. So it's important that we all get our labs drawn on a regular basis and make sure that we're taking care of that.
Mm-hmm. Yeah, thank you for being a warrior, like Tiffany was saying.
Thank you.
Yeah, that you're so strong, honestly, because I feel like I stab my toe and I'm such a baby. You have to put it into perspective. Like, we do not have it as bad. Like, people say, "Oh, my back aches." You're like, okay,
yeah,
calm down.
yeah.
Like, you just have to walk in other people's shoes. And I feel like, especially for this podcast, I want people to know that they are helping other people and you're helping them to just feel better in the morning and
Right.
get up and not feel so weighted down by their bodies and to live their lives. And that's so important, especially right now where everybody can use that little hope in any way they can get it during this crazy, crazy time. Mm-hmm. Yeah. So thank you. Thank you for telling your story with us.
Thank you for having me.
Yes. For Tiffany, so if we are in, say, areas that are more on the poverty side and we can't get to anywhere Red Cross, is there any way that they come to those areas as well?
So the American Red Cross can bring our blood mobile, which I love to talk about our blood mobile because it was created by Dr. Charles Drew, African American, who led the American Red Cross blood program as its first medical director. He helped create the Blood Mobile, which was a way to transport blood units as well as to be able to get blood donation. And so we have our Blood Mobiles that we can bring to any area. So no matter if it's a church, community center, organization who wants to host a drive, it doesn't matter if it's in an impoverished area or a well-to-do area. You know, the American Red Cross, our mission is to alleviate human suffering by mobilizing the support of generous volunteers. And so we will bring our Blood Mobiles wherever you are. It's just a matter of calling 1-800-RED CROSS or visiting redcrossblood.org and getting in contact with us to host a blood drive. We have a tab on our website that says host a drive or host a blood drive. And you just put in your basic information as a contact, and we'll have someone reach out to you to see when is the best day, time to set up that drive.
That's awesome. I didn't know there were like, I knew I've seen them and I've gone to them, but you just never know that like they were just wheeled there, you know?
Yes.
Like yes, that's really good. I have a question. How do you know what your blood type is for people that don't know at all?
So that's a really good question. We get that question all the time. So most people find out from their doctor or from having their blood drawn. And some people, of course, find out at birth, and it kind of sticks with them. You can ask your doctor if they have that information in your chart. But if you don't want to go to the doctor and you want to know your blood type, the best way to do it is to schedule an appointment to present to give blood, because when you come to present, you know, whether you make it through the process or not. And I mean by that, sometimes people, we do a health history portion, and we do a mini physical portion where we check your hemoglobin, that's your iron levels. We check your blood pressure to make sure that you are feeling well and eligible to donate that day. And so sometimes, you know, that can disqualify you from being able to donate if those levels are too low for your iron, or if your blood pressure may be too high or too low to give that day. But you can come back the next day, perhaps, and see if you can try again. But whether you get through that process or not, we will send you in the mail a Red Cross blood donor card that has your blood type on the card. So that's an awesome way to find out your blood type if you're unable to get in contact with your primary care physician to find out what your blood type is.
And what blood types are most rare?
So there are 3 types of blood type: A, B, and O, and that's A positive, and A negative, O positive, O negative, B positive, B negative, and then there's AB positive and AB negative. So African Americans make up about 47% of O positive blood, which is why it's super important for us to donate, because that O positive blood, it helps those who need a transfusion from anybody. It also helps to support newborn babies in the NICU who may need a blood transfusion. So oftentimes that O positive blood is for that. Now, we do make up about 4% of O negative blood, which I said is that universal donor blood. Our white counterparts make up about 8% of O negative blood. So honestly, O negative, I would say, is the most rare. And like I said, it's the universal donor. And so that's why if a person is O neg, it's like they're a superhero. They're like a unicorn in a sense, because they're so impactful and so powerful, but yet so rare. Other rare types are AB positive. That's a rare blood type. African Americans make up about 4% of AB positive. White counterparts make up about 3%, Hispanics make up 2%, and Asians, they make up 7%. So they lead in that AB positive. And AB negative is even lower. African Americans make up about 0.3%, whites make up 1%, Hispanics make up 0.2%, and Asians make up 0.1%. So those are the most rare. Also, B negative is a rare blood type as well. So all blood types are needed. What we don't want people to think is, oh, they only need O neg and I'm not O neg. We need all blood types. And so this discussion that we're having today is so important, because if a sickle cell patient has B negative blood, if they have AB positive or AB negative, they most likely need someone with the same type, who's the same ethnicity, to help support them in their journey. Nicole was talking about how when her hemoglobin is low, that it leads to anemia, it leads to pain, but it can also lead to strokes and other severe complications when that blood is needed. She also talked about being able to receive 1 unit of blood or 2 units of blood in one transfusion setting. When you donate blood, you're donating 1 pint or 1 unit. And that 1 unit can help save up 2-3 lives. And that's because we're able to separate blood components. But in a case like Nicole's, oftentimes she's going to get that whole unit of blood. She needs that whole unit of blood. So when she said that there's one time that she's received 2 units, if it hadn't have been for 2 blood donors who gave those 2 units that she received, we don't know what could have happened for her. And so it's so important that if you are eligible, that you do give. I also do want to share as well, because you talked about eligibility earlier as well, and wanted to know what are some things that could make you ineligible. And we also talked about some things that people think makes them ineligible that does not make them ineligible to donate blood. And so I wanted to make sure that I shared that people who carry the sickle cell trait, which is inherited probably from one cell gene from one of their parents. They may not have sickle cell disease, but they have the sickle cell trait. They may be eligible to donate blood as well. So that's important to know too, because so many times those who carry the sickle cell trait are wanting to know how they can help and are kind of concerned if they're able to help as well, and they can.
Okay, so it won't affect your blood in any way if you have that trait?
If they just have the trait and it has not developed to sickle cell disease, and they have not, had any complications or issues, any symptoms that a sickle cell patient would have, they could be eligible to donate blood as well.
Okay, that's very good. It's very
That's
good.
Great.
Mm-hmm. Yes, thank you both so much for being on. I've learned so much, and I already want to start like my own little like blood drive.
Awesome.
Maybe I can talk. P3 John. John, hello. I know you're listening. We can start a blood drive with Red Cross. That would be amazing, especially right now, because learning through both of you how important it is to have the Black community come together and know the importance of why we have to donate is really, really just inspiring, just to know how it is helping people and the importance. And it's not just, oh, I'll give blood today. Or because so many people are like, oh, I'm giving blood. It's just like nonchalant if they don't have to be a patient and receive blood, or if they don't know anybody who has to receive blood, they don't see the other side of how it affects our warriors like Nicole. Mm-hmm.
Right. Mm-hmm.
So we're about to be done, but before we go, I just wanted to ask you, if someone was maybe scared about donating or kind of apprehensive still a little bit, what encouraging words would you tell them?
I would tell them that every 2 seconds, someone in the U.S. needs blood, and you never know when that person may be you or someone you love. For me, it was my grandmother. She's 89 years old, had a slip and fall, was on blood thinners, and lost so much blood from fracturing her hip. She required blood transfusions, and it was during a time during the winter, like now, when the blood supply gets low. And as someone who knows where we were in terms of our inventory during that time. I'm hoping and praying that the blood is on the hospital shelf for my grandmother because I want her to live. And it was. And to hear from my family that those 3 units that she needed were available from a generous volunteer donor brought tears to my eyes and made me so proud to be a Black blood donor, knowing that I had paid it forward. Me, my dad, and so many others had paid it forward, not knowing that it would come home to help our family. And so if you're apprehensive about donating blood, you're scared of needles, whatever the excuse may be, that needle is just a little momentary pinch. I promise you, it does not hurt. And the way you feel after you've given is the most fulfilling thing ever. And the cool thing about it is after you give, you get juice, cookies, all that good fun stuff to replenish, okay? And you get a sticker that says, be nice to me because I have given blood. And I promise you, people will be nice to you because you have given blood. So pay it forward. I promise you, knowing that your donation can help save up to 3 lives and that one day that may be someone you know makes all the difference.
Yes. Thank you for that. Thank you for that story you shared. That brought giving me chills.
You're welcome.
And Nicole?
So I would just say, I've been in the chair and have received 1 unit of blood, but needed 2, and have waited up to 5 hours to get the second unit of blood. It actually came from St. Louis. I'm in Kentucky, and I waited 5 hours to get the second unit. So I would just say that you are giving a precious, precious commodity, a life-sustaining and a life-saving, something nobody can give or take but you. And it helps me walk. It helps me live my life every day. You're looking at a perfect example of what blood donation is and does.
Yeah.
Greatly appreciated.
Thank you both so much. Yeah. Thank you both so much for coming on. I've learned so much, and I hope everybody watching and listening also learns and also gets motivated and, inspired to go donate themselves. Even if you're not a Black blood donor that is listening, like they said, we need every single type.
Everybody.
Mm-hmm.
Everybody who can and who will. Mm-hmm. And also, too, if you've recovered from COVID-19 and you're well, we need you to donate blood as well, too, because those blood donations are helping to support critically ill COVID-19 patients, too, through the convalescent plasma program. So if you're wanting to know as a Black person or any person how you can help someone who may be critically ill from COVID, what can you do? Your blood donation can help save lives.
Yes, I didn't even know that was a thing.
Yeah.
Yeah. Go to the redcross.org and learn and educate yourself, because I bet you'll find something where you want to go volunteer, or, they're like, oh, I can actually donate. There's a lot of information on there. And again, we will link every link that we've talked about so you and your family can go educate yourselves and hopefully donate. So again, thank you, ladies.
Thank you, Jodi.
Yes, and have a great day. Bye.
Bye-bye.
Bye-bye.